Florida's Surgeon General says for us to stop getting the COVID vaccine.
Fox 35's Hannah McKenzie is joining us live in the Alert Center tonight. So, Hannah, he says what's in the Moderna and Pfizer vaccines is a problem.
Yeah, Luann, Florida Surgeon General Dr. Latipo says he has safety concerns pertaining to the discovery of billions of DNA fragments found per dose in the Pfizer and Moderna COVID vaccines. And he says those concerns have not been addressed by the FDA or the CDC. Dr. Latipo says if the risks of DNA integration with COVID vaccines cannot be addressed, then the vaccines aren't appropriate for use in humans. He says he sent letters to the heads of the FDA and the CDC specifically questioning how this would impact humans in three main areas: healthy human genes being transformed into cancerous cells, chromosomal instability, and how the integration could affect unintended parts of the body, such as the heart, brain, lungs, even the injection site itself. We asked local Dr. Michael Sparks to weigh in. Dr. Sparks telling us with the state Surgeon General saying one thing and the FDA another, health providers are left stuck in the middle.
New things are scary. If we look back historically, we've introduced new medications that we were told were very safe, were going to be very effective, and they turned out not to be safe or effective, and they caused a lot of birth defects, things like that. So it's not unreasonable to be worried about things that are new, and that's where the research comes into play. There have been so many millions of doses of this vaccine delivered, though, that if we were to expect to see some of these, theoretical problems, we should start seeing them. There have been so many millions of doses of this vaccine delivered, though, that if we were to expect to see some of these, theoretical problems, we should start seeing them.
I'm Angus Dalgleish. I'm a professor of oncology at St George's, a consultant medical oncologist. And I have started to notice that several of my patients have melanoma who've been stable with stage 4 disease. They've had very good immunotherapy or other treatments, and I've been reviewing them from 5 to 20 years. I've noticed that I have now over 6, possibly 7, even an 8th yesterday, who've clearly relapsed following the booster vaccine. At first, we didn't put the two together, but when patients said, I felt awful since the vaccine, I've just been drained, they described symptoms of like a long COVID, and the next thing we know, 2-3 weeks, couple of months later, they've got clear evidence of relapse. And these relapses are quite aggressive. They're not a gentle relapse. They're relapses that are requiring systemic therapy as opposed to a little nodule that requires surgical excision. But it's not just this. I'm now very much aware in my own circle of many people who are having, they haven't got melanoma, but they've never had anything before, but they've got lumps and bumps and they're not feeling well. And 2 people I've interviewed at great length, they all put it down to feeling awful after their booster. They were fine with the first 2 vaccines or just had shivers, flu, etc. But they've described being very tired, very fatigued, wanting to stay in bed, and this is dragged on to the point where they've gone to the doctor and they've had blood counts and investigations, and I now know 7 of them. 2 of them have leukemias and the others have lymphomas, and 1 of them has a very bad myeloma, which he was absolutely sure was instigated by the booster as he developed the dreadful symptoms. So I want to bring to everybody's attention that I think that this does not look like a coincidence to me, and we need to join forces and see if this is a real effect, and if it is, we must stop all the boosters immediately. Thank you.
If the media was legitimate, they would be talking about one of the biggest crises that's happening in this country right now, which is a massive increase in all-cause mortality.
Yeah.
It's a massive increase, and they're completely silent on it. It's like in some age groups, it's a 40+% increase in all-cause mortality, heart attacks, strokes, cancer. Gee, what do you think happened that changed where all of a sudden there's this massive increase and it coincides with something else? Don't you think maybe they would investigate that? Don't you think that you would have some sort of investigative reporter that dives deep into this and gets to the bottom of it? No, they can't. Because of what you said.
They're
captured.
They're totally captured, 100%.